Roll call, please.
Powell.
Here.
Here. Sorry. Hoffman.
Here.
McGilvray.
Here.
Jackson is absent with notice, as well as Nelson. Cavell.
Here.
Gingell is absent with notice. Kuhn.
Here.
Lubes.
Here.
We have a quorum.
Thank you. Please rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our first item is approval of the minutes dated July 27th. I have a motion by Commissioner McGilvray, support from Commissioner Powell. Any comments about the minutes? All in favor say.
Now we say, please vote. And the prompt will come up on everyone's screen.
All right, please vote.
Okay, now watch your screen, and you will see a box come up, and you hit the way you're going to vote, and the word save, except for Commissioner Hoffman. You just will
Commissioner Hoffman,
indicate to
if you want to
Tracy
vote
your vote.
verbally,
I'll just mumble.
go ahead.
Voice vote.
Yes.
Thank you.
And so then once all the votes are in, you can save as passed. And then in the AV room, they're getting a signal and switching the screen over here to show you that it passed.
Okay, and you see this publicly here and also on our public portal.
All right,
And Chairwoman,
So we have 6 yeas and 0 nays.
thank you, the motion passed.
This is fun technology.
On to approval of the agenda.
Because you must have marked off.
So she will
So-
prompt that.
Oh, I have to wait?
Yeah.
Okay.
No, we're
So
ready.
I
I'm
need a
just looking at
motion
the
for
bottom.
approval of the agenda. Motion by Commissioner McGilvray, support from Commissioner Hoffman. So it is now time to click on details and vote. Oh, you don't have to click on details this time. Oh, we're getting better. Okay?
And so Commissioner Hoffman,
Oh, yes.
Thank you.
and you can announce you.
Okay, we have 6 yeas, 0 nays.
All right, that motion is carried, thank you. Our next item on the agenda is public comment, and at this time, there are 4 people signed up for public comment, so I would first like to ask Cecile Skripak to come to the end of the table and introduce yourself, and you would have 3 minutes for public comment. Did I say the name wrong?
No, you're fine. I'm just here.
Oh, thank you.
Sorry.
All right, thank you.
I can present myself anyway if you wish to. I'm just.
It's nice to have you here, thank you.
Thank you. Sorry for that, the confusion.
Our next speaker is Catherine Kennedy. Okay, thank you.
Just select them all. Yeah, that's what
Welcome
Good
back.
morning, Commissioners. My name's Catherine Kennedy. I'm from Lake Orion. And once again, I'm dismayed about the lack of transparency this Board of Commissioners exhibits. The meeting that was canceled at 9:30 this morning did not even exist on the web page that the public has been accustomed to going to get their meeting information. This meeting did not exist there either. It's in archives. I don't understand how it's so difficult to be able to allow the public to have input or information or even an agenda. I couldn't even download anything for this particular meeting. That's been my practice since the packages are so massive. The only way for me to follow along is to download to my computer the agenda items to have some understanding what's going on with the meeting. But today, there's not even anything there. Now, I have very serious concerns because I did see this morning when I went through that there's a miscellaneous resolution about the Oakland Together Mental Health and Wellbeing Nonprofit Grant Program Policies and Procedures. And it's stating that because MR 21284 was adopted on June 30th, they don't have to go anywhere but this meeting to approve all the spending that they want. And I have a serious concern because it doesn't seem like these grants are actually even being managed by county staff. It does seem to be different alliances that are actually managing housing and different things. And the HUD grant, specifically, the award letter that was omitted from the documentation approved that all these funds in May specifically states that it's not allowed to be used for people who are non-citizens. And I've been in other meetings where they've clearly stated that all these benefits, opportunity for jobs, everything is eligible for citizenship, but I'm not clear that that actually is in compliance with the federal law governing the funds that were awarded under those letters. The fact that you have this meeting, and when I came for the 11 o'clock, lo and behold, there's a Democratic caucus meeting already finishing up, deciding how to spend all the money for the county without any input from the public, again, non-published. And this award, this June 30th meeting that approved all the spending for all the American Rescue Plan funds, to me, even the minutes do not correctly represent what really happened that day. It was shameful the Democratic caucus changed their meeting from 5 to 3:30, then inserted an unpublished Finance Committee meeting at 5:45 to change the language from an assignment to an appropriation to shove it into version 3 of the full board, so that the appropriation language was literally done 2 minutes before the full board meeting was to convene. I don't know how you can call this transparent. I don't know how you can call this proper public governance of our public funds, and I'm very disappointed. Thank you.
For clarification, you're able now to see the agenda?
No.
In the packet?
No. I tried to download the whole thing. When I went to the normal website, it takes me to only the ad hoc committees, but it says it's meeting archives now, and it used to say meeting resources. I do have some screenshots if you'd like to see what I'm talking about. So it changed the entire, you can't even see this meeting exists unless you follow the green arrow on page 1 to go to page 2 to find, oh, there's a whole nother screenshot from the civic clerk site or something that says contrary information. I had found that on the 18th and 19th. There were 2 different dates for the full board. They wound up canceling it. So how in the world are we supposed to have any idea what's going on? It seems deliberate.
Thank you. It is on the site, so if you have a few minutes, staff will show you how to access that.
I haven't had any problem since April accessing it until just recently. There's been changes made on the site, and the site is not the same. It doesn't show the same number of meetings. It used to show about 8 meetings, so you could see multiple dates,
Well, there's
maybe
another
plan
page
ahead.
to it,
But now it's down to like 3 or 4. It says it's an archive, so it's totally different the way it's presented. And when you go to the other screen, I did try to download the whole package, because there is a little blue line that says download packet at the very top of that screen, but it didn't work. I haven't found where it went anywhere, and I checked my computer by date.
Thank you. So
So-
if you have a minute afterwards, we'd be happy to show you how it works. We've all had training in the last 2 weeks about our new system also.
Well,
All right.
a new system doesn't explain not letting the public in.
Yeah, thank you. Our next for public comment is Desiree Dragon.
Oh, excuse me. Hi, I'm a parent of a Walled Lake, well, a parent of 3 Walled Lake school district students. Bear with me, I'm a horrible public speaker. My story is not to gain pity. My hope here today is to spread knowledge. Every Wednesday morning, I walk into an infusion center where everyone knows me by my first name, as I've been going for the past 3 years. After taking all my vitals, I'm put into a short stay room. The nurse comes in and takes the Tegaderm patch off so she can clean the numbing cream I applied at home around my port. The MediPort is a device that's placed under my skin, which is attached to a catheter in a large vein above the right side of my heart called the supravena cava. The nurse then scrubs her hands, puts on sterile gloves, and pokes a 2-inch needle through my skin and into the port. I lay in bed for 4 hours until my treatment is done. After my treatment is done, I'm flushed with heparin and on my way. I was diagnosed with a form of dysautonomia called postural orthostatic tachycardia. A virus called Epstein-Barr destroyed part of my autonomic nervous system. That's why I'm shaking right now. I won't bore you with the debilitating symptoms or go into detail about my ER visits, but I'm thankful of my infusions help, but not every treatment plan is 100%. A virus did this to me. Now here comes the interesting part. This same chronic illness I have been diagnosed with is now being diagnosed in long hauler COVID patients. In fact, one of the nurses at my infusion center is one of them. Now here comes the big worry. This isn't your grandfather's COVID anymore. This Delta variant has 1,200 times the viral load of its origin. Doctors are now seeing children come in with more severe illness. I have 2 boys who aren't eligible for the vaccine yet. I don't know if my boys are dispositioned to develop what I have if they got COVID. Their pediatrician says to be extra cautious as there's still so many unknowns. The Journal of the American Medical Association reported 1 in 25 children have had symptoms lasting longer than 12 weeks, which means that 1 in 25 children have long COVID. Some of you may be thinking, keep them home if you're that concerned. You know what? I wish I could. I really do. But they deserve an in-person education just as much as another child does. I'm fortunate that my kids understand the importance of wearing masks. They not only know it protects them, but others around them. What's concerning is they'll be in close contact indoors with unmasked, unvaccinated people for the first time since the pandemic began. Even though they'll be wearing a mask, their level of protection isn't as high as it would be if everyone participated. If they were exposed in a random mask setting, the viral load wouldn't be as high as an unmasked kid. However, any viral load concerns me, as I don't know how much viral load is needed to destroy parts of an important nervous system. So I'm here today to ask whoever, consider a mask mandate for Oakland County. Because buckle up, Delta's going to take us for a rough ride.
Thank you.
Thank you.
Our next public comment speaker that signed up is Deanna Smith.
Hi, my name's Deanna, and I'm not a very good public speaker either. I don't have the same story as Desiree, but my children are walking into school next week as well. And fear is real. And I'm trying to understand the difference in the different counties, why there are recommendations and why there are mandates, and why so many of our superintendents and boards of education do not feel that the recommendations, which when I read them from Oakland County, seem very, very clear to me what is asked of parents, what is asked of our school district to keep our children safe, maybe to eliminate some community spread. I realize most children will be just fine, but I think beyond that, to the broader community, to our hospitals, to our hospital staff that's very tired, what will doing none of the recommendations that have been laid out by the county health department, what will those impacts be in a month on our county? I want my kids to have a continuity of education this year. They've been disrupted for 2 years. And I fear without any of your recommendations being put in place in our school district, they are not intending to at this time. They have left public health decisions to public health, which I completely understand. They don't feel like they're experts. They say that their extra staff and monies have been eliminated this year to be able to, combat this large beast that we're all facing. And I don't know what the answer is. I just would like to have somebody understand that when children don't have an option for additional protection like we've all had, whether our choice was to protect ourselves with a vaccine or not, we've had that choice. My kids haven't. And I just want them to be able to go to school this year and stay there. And if it doesn't mean masks, could we, put some kind of mandate in place to keep them any form of safe? Crowding 400 kids into a cafeteria for a all-school assembly when we're all sitting here distanced and masked and behind barriers doesn't seem like a fair thing to put my kids into next week. But that's what many of us are facing. And I just ask maybe some clarity to some of the superintendents that have not yet jumped on board with your recommendations. Maybe there could be some more pressure. Maybe there could be some more questions and clarity. That's all I'm asking as a parent. Thank you.
I have one question.
Yeah.
What school district? If you don't mind just sharing the school district.
We are in Clarkston Community Schools.
Okay, thank you.
And it seems, I guess, if I look at the map of what I've understand is half of the Oakland County districts seem to be implementing some kind of recommendations. I don't know if they're tied to transmission rates or what they are, but it seems like to me, when I look at the map, Northern Oakland County has not made any decisions to do any of those things. It seems like many of the districts in our surrounding area are following the same protocols, which are really none, which is concerning. So I just ask you to look into that, and whatever your opinion may be, I think it's something to note for healthcare staff. So
Thank you.
Is there anyone else for public comment? All right, public comment is closed. We move on to communications. There are 3 items under communications. The Edward Byrne Memorial Justice Assistance Grant Program application, the Oakland Community Health Network for Substance Use Disorder Prevention Service grant application. And the last item is the medical marijuana operation and oversight grant order 2 performance report. Do I have a motion? Motion by Commissioner Powell, support from Commissioner Hoffman. Any questions on the communications? Are we doing a voice vote now? No, everything's on
So
line.
if speakers have requested to speak, it wasn't them right there.
Okay.
So now it's time to vote.
All right. Looking at your technology, vote for communications, yes, no, abstain. Now's the time.
Yes.
Thank you.
I know, right?
You can announce this back too.
Oh, okay, it's 6 yeas, 0 nays.
All right, motion, communications is passed, thank you. We move to our regular agenda. The first item is the Oakland Together Mental Health and Wellbeing Nonprofit Grant Program Policies and Procedures. Who do I have a motion by? Motion by Commissioner Powell, support from Commissioner Cavell. And from our executive office, we have Alice Audi Figaro here to talk to it. This, along with our deputy director, Chris Ford, possibly. Welcome.
Thank you, Madam Chair, members of the committee. Appreciate your consideration of this resolution. As you recall, the board took up and adopted unanimously the, I think, $27 million in authorization and sometimes appropriation, depending on which program, for the acute focused projects and programs back in June 30th. One of those provisions was a $10 million nonprofit mental health and well-being grant. And one of the requirements in the resolution was to come back to the Board of Commissioners and receive approval for the specific grant policies and procedures. In discussions with the board leadership, rather than just having the committee approve this, we've presented a resolution that would go to the full board for their consideration. With that, I'm going to turn it over to Alice Audi Figueroa, who's joined the administration as a special rescue plan special advisor. Brings a great deal of expertise and knowledge and has taken the lead on this project. Alice?
Thank you. Good morning. I think that you all have in your packets some information about what we are planning. I'd like to start with general overview of how we see this money to be spent, and then talk a little bit about how we plan to administer it. So we have set this up as a competitive award. To be eligible to complete an application, the applicant must be a 501c3, so this is a nonprofit grant. The spending has to occur within a year because this is to address acute needs. Obviously, we have to follow the Treasury guidelines, which are developing as we speak. So to the best of our ability, we have written in what we know so far. The applicant must be either based in Oakland County or serve Oakland County residents. So these monies must go to Oakland County residents. The applicant must be a provider of evidence-based interventions. And that is a Treasury rule regarding evidence-based. And the people who are doing the intervention, if appropriate, need to be licensed by the state. So we are looking for programs that we know evidence-based means basically there's been research done that suggests that the interventions actually work. The services should include, but are not limited to, mental health treatment for adults and children, substance misuse treatment, other behavioral health services, hotlines or warm lines, crisis intervention, overdose prevention. So as you can see, we tried to make it as broad as possible to encourage as many applicants as possible, since we know the need in the community is so great. We've decided to offer 3 levels of award, the lowest being between $50,000 and $100,000, then between $100,000 and $250,000, and $250,000 to $500,000. This way, we encourage maybe a smaller agency that normally gets maybe a little elbowed out when we talk about competitive grants, an opportunity to compete against like-minded, like-sized entities. If you apply for the bigger grant, the $250,000 to $500,000, you have to have a minimum annual budget of $4 million. The reason that we put that in is you have to spend the money within a year. And so to steward the monies in the most appropriate way, we thought if you don't have $4 million in your budget already, spending $500,000 in a year could be challenging. So we want to make sure that these monies get spent in the community within the next year to address these acute needs. The way in which we are administering this is we've partnered with the United Way for Southeastern Michigan. They are in the process of designing a grant application. They will accept those applications. They will evaluate the applications. They will make a recommendation for funding. They will then bring their recommendations back to a committee that will include commission and executive office participation. Those will be reviewed, and then award letters will be sent out. We would like to get the award letters out, I guess if it's going back to the commission, it'll be the 3rd week of October, to give people enough time to apply, get them scored, and get the recommendations in place. So that is, that's the short nickel. Are there any
Nice
questions?
summary. Thank you. Commissioner Hoffman?
Yes, thank you, and thank you for the presentation. I have a question. We've allocated $10 million for this grant program. Do you anticipate that all $10 million will be used?
I hope so, yes.
Okay.
Yes, we are encouraging nonprofits in the county to participate.
Okay, and I know that we're paying a 3% fee to United Way to run this project.
Yes.
Let's assume for a minute we only grant $8 million. Is it 3% of the $8 million, or is it they get 3% of the $10 million whether we spend it at all?
My understanding is it's 3% of $10 million. And just so to give you some frame of reference, the Treasury guidelines allow up to 10% for admin fee.
Okay, my next question is, will there be oversight from the county?
Absolutely.
What oversight will there be?
So the United Way will be obligated, I mean, we don't have a contract yet, obviously, until this is approved. The United Way will be obligated to report to the county on a quarterly basis. The county, in turn, I know is responsible to reporting back to you on a monthly basis. So, you know, the months where we don't have new quarterly information, we'll just tell you what we know has happened. But yes, there are quarterly reports from United Way that come to the county that feed into the county's obligations to report back to the federal government.
Yeah, and I do believe too, probably the 10 million will be granted, but I guess it's hard to pay a 3% fee if you only grant $8 million, because obviously the percentage is based on the amount of work that has to go through granting this money. That's just.
Well, to explain a little bit more about what their responsibilities are, right now they are developing the application. So regardless of how many people apply, they are developing an application. They will be reviewing those applications. They'll be scoring those applications. And then once they are granted, then really the responsibility is to follow the reporting and monitoring and to ensure that everyone reports on a quarterly basis. So some of the work is front-loaded, if you will.
If I can as well, Commissioner, as Alice mentioned earlier, there's also going to be a bipartisan executive and commissioner-based committee that will oversee the program, similar to as we did with the CARES Act and the Oversight Committee. So commissioners' voices will be heard, and it'll be public documents.
And I think this is a good plan to support community mental health, because obviously that's been lacking for years. Thank you.
Commissioner Kuhn?
I'm sorry to.
Excuse me, she gotta acknowledge you. You can't speak in our meeting like that, so you gotta wait.
That's why I'm asking.
Okay.
I know it's work, so I just wanted to know if it's possible for us to ask question or.
No,
if it's done.
just us
That's
commissioners.
fine.
Okay,
Just-
thank you.
Thank you.
Thank you, Madam Chair. I had several questions. Has any analysis been done of the expected numbers of applicants?
I guess the closest thing to analysis would be we have experience in the CARES program. And so the plan is to have a joint press announcement between the county and United Way to make sure that everybody within the county who is eligible to apply knows about the program and applies.
Okay, so is there any idea of how many applicants are expected?
I don't have any idea.
Do you know if anyone does?
I assume that United Way does. I can call and check and find out for you.
Okay. I mean, to me, that's important. I mean, we've had programs that have 15,000 applicants, and we have others that have 10 applicants. That's a massive difference in the number of applicants to be expected. I would expect that we'd have some idea of the number of applicants. Let me ask,
Commissioner, to your question, I think
Sure.
we're also building off the experience from the nonprofit grant during the CARES Act round, which was $10 million administered by United Way, and it was a very successful program, I think you'll recall. And the money went out, relatively quickly with a low administrative cost. So I think that's the basis of the number. Is
okay,
the
do you have an
experience.
idea of what was in that program? How many applicants were in that program?
I want to guess 100, but I'm guessing.
We can
I'm
get
not-
that information to
I'll
you,
get it for you,
Commissioner.
though.
All right,
It's not
great.
going to be 15,000, because I don't believe that there are 15,000 nonprofits in
Well, and I
Oakland County
wouldn't
that
either,
provide.
but we've had, like the small business stuff, we had, thousands and thousands.
Yeah, so
Okay.
because it's limited to nonprofits who do mental and behavioral health, I mean, that's a kind of a finite number.
And that's what I would expect. I wouldn't be surprised at that. What is the rationale for limiting the application timeframe to 3 weeks? That seems short from the comparison to a lot of the CARES Act timeframes.
Well, a couple of things. One, we are relying on United Way's vast experience with grant making, and that was a recommendation if you want the money out in an acute way. Now, if you want to do it over a longer period of time, then it does make sense to have a longer application period. But 3 weeks is generally not a short period of time to submit an application, at least in my experience.
Okay, and I assume then that there's going to be a massive informational thing prior to those 3 weeks. Is that a fair statement?
There is a press conference that we are in the middle of trying to figure out a date, given when the commission might approve this. And the plan is to have Dave Coulter and Dr. Driver from United Way do a public announcement, and both teams, both press teams, marketing teams, communication teams, will get the word out. United Way generally sends out notices to anyone who's applied before so that they are aware of it. And I would hope that each of you would make sure that everyone in your district knows about it.
Yeah, if I can, again, based on the CARES Act experience, and as Alice mentioned, the idea here is acute need and to get the money out as fast as possible. So we can't do that analysis and receive United Way's recommendations until the grant period is closed and all the applications are in and processed. And our experience last year, I believe there were some grant programs where we really, had to extend the application period, due to the problems that getting the word out. And I think if that's the case after this, if we have unexpended funds, then we can have that conversation with the board about, extending the program or having an additional period to apply.
Okay, and when do you expect the application period to start?
When's your board meeting?
Okay.
Yeah, so the calendar that was in the packet, I was unaware that it was going back to the board, so it says September 1st. I think your next board meeting is September 2nd, so assuming that that goes forward, then I don't know what the days of the week are, but it would be as soon after that as practical.
Yeah, I mean, the 2nd is a Thursday, and then you have Labor Day weekend.
And Rosh Hashanah, and yeah.
And all the stuff the following week, so I'm assuming.
We will get, from the time that it becomes available, there will be 3 weeks for people to respond. So
Right.
the calendar just gets pushed.
And again, I know Commissioner Hoffman asked about the United Way fee. Now, this $300,000 fee, do we have any idea of the amount of work, personnel, and resources that are going to be expended? I mean, I understand, you're saying 3%, but $300,000 is a lot of money for a contract, and I'm just wondering if there's some basis for determining what the size of the fee is.
Yes, we specifically asked them to look back at the CARES experience and to calculate what United Way's experience is in terms of covering their costs. And that's what they seek to do. They're not seeking to make money on this grant. They're seeking to cover their costs. So yes, that was our request.
Okay, well, and in your Appendix A, which is part of this resolution, it states, organizations may not have received federal, state, county, foundation, or philanthropic support, including reimbursements. And this language, to me, is concerning. Sufficient to continue providing service in the community. I mean, that seems very vague, unclear, and overly restrictive. I mean, you're saying, is there any understanding of what that language means?
Yes, don't double dip.
Okay, well, I get the idea of double dipping, but this seems way more expansive than that because it says sufficient to continue providing service. I mean, I assume these are ongoing operations, so I don't understand that language. It is just very unclear to me as to, and I mean, you have $4 million annual budget for the big grants, right? So they're going to be continuing providing service in the community regardless.
That language we submitted to Guidehouse to make sure that we were following Treasury rules. I'm happy to resubmit and express your concerns and see if they can come up with something that is more clear to you.
Right, yeah, there's an issue with the guidelines in terms of not supplanting existing resources.
Well, I understand that part,
and
but
then having to do the due diligence to ensure that an organization isn't receiving funding from the state or the federal government for the same purpose, so.
Well, I understand
as Alice
that.
mentioned, if we need to work on fine-tuning the language to make it clear, we're happy to do that.
Yeah, it just is important. I mean, yes, double dipping, absolutely wrong. But this doesn't seem clear to me as to what that
So
just
so
addresses double dipping. It seems a lot broader than just double dipping.
So just let me repeat back to you what I've heard your concern to be so that I'm clear with Guidehouse, is that the language makes it sound like if you have enough resources to continue your servicing now, you can't apply for these monies? Is that your concern?
Well, they've received sufficient funding to continue providing service in the community. I mean, all these organizations, I would assume, would have sufficiency to continue providing service in the community. It's not clear to me, and and it seems if that were literally put in there, it would be extremely restrictive, in my opinion. Again, if there was some clarification, that might be helpful.
Okay, we can work on that, for sure.
What is expected in the quarterly report from the grantees?
We are in the middle of designing that. There will be the requirements, whatever Treasury wants, Treasury will get. For us, we are looking at understanding the demographics of people who are served, what interventions were used, how many people were recruited, of those people who were recruited, how many people participated. So, the kind of information that would help us understand that these monies actually went to individuals in the community that needed the help and they got the help.
All right, and my final question was, why isn't the Grant Review Committee part of the resolution?
I think I can respond to that, Commissioner. So the initial draft acute program resolution we sent over followed the model of the oversight committees from last year. The feedback we received from the commissioners in those discussions, they didn't want to pursue that option again. So we're trying to figure out the best hybrid. We're happy to involve you to the extent that you'd like to be involved, but just reacting to that feedback that we don't want to continue oversight committees. This is the solution we've prepared.
Well, okay. I personally am not going to vote for this largely because there should be commission oversight and the commission should be involved in it and it should be part of the resolution.
We have no objection to including that in the resolution.
Thank you very much for your answers and your time today.
Commissioner Powell?
So, Commissioner Kuhn, I was one of the commissioners served on the nonprofit stuff for the CARES dollars, and everything that they have said to a T is part of how that process went. However, I am also in agreement with you as far as us being at the table, both party lines, commissioners' representation, because I thought that even with, I can't remember who you all have from your side representing, but all of us at the table being able to deliberate on nonprofits. Once the scoring came back of who was going to get what, we were able to also look at some of them that did not come back to get approval. We could talk about it and figure out and find out what were some of the factors of why they didn't qualify, this, that, the other. Those were good discussions. So if I just want to co-sign everything they said, that the process I thought went well, and the only reason why I was one that fought to be on it because, a lot of them nonprofits do a lot of work either in my city or are in the city. And I thought the process went well, but I will also say, can we send back that, yes, we do need the commissioners at the table with the review process. However, because I thought it went phenomenal with us at the table, and I don't understand why it had to change.
I agree with you. Thank you for your...
So thank you.
If I can, just the resolution before you adopts the procedures as an attachment. In those procedures lays out this committee. So it may be semantic. If we'd like to include it in the resolution, we're 100% supportive. If you'd like to go back to having oversight ad hoc committees, we're fine with that as well. Our intention was to involve the board.
Right. So for me, I'm in vote of it moving forward. However, that is the only caveat. So if leadership or our administrative staff can coach me on what I need to properly say to make sure that that is at least
happy to work
revisited. So we have, even if we have to talk to our leaderships to make sure we get an understanding, to make sure we have proper representation and we're comfortable as commissioners of what the setup is currently and what we can critique. Thank you.
If you're willing to move it out to the floor, I'd be happy to work with you on an amendment to incorporate that.
Okay.
Commissioner Hoffman?
I agree with you, Angela and Tom. And Chris, you just suggested we could make it part of the resolution right now. So I think that's what we should do, is come to some agreement and who's going to be on the, from, one from each party or each side, or however you guys think it would work. I think this should be done now, not revisit it at a later date.
Oh, it's already set up.
I mean, Commissioner, if you'd like to use the language we used for the last ad hoc committee.
I can't hear you, Chris.
If you'd like to incorporate the language from the last ad hoc committee, I think it was the pandemic ad hoc committee oversight. That was the last one that was approved by the board.
Are you okay with that one, Tom?
Isn't that what that is?
Yes.
Commissioner Cavell?
Okay.
Oh, I just wanted to say thank you to Alice, because I had a bunch of probing questions about this too, and you answered them very well, and I appreciate you and all the work you've put into this, because you've been the one that's led this from the start, right?
Mhm.
So I appreciate you. That's all.
Thank you. Commissioner Kuhn, are you back up to speak again?
Yes, thank you, Madam
Okay.
Chair. I just had one thought, and that is that the committee isn't even part of Attachment A, which was part of the resolution. It's part of a memo that is in the packet. So it just creates concerns for me that it should be part of the resolution.
Yeah, I
Thank
agree,
you.
and that's probably my fault in not understanding what all the different documents actually mean. It was clearly the intention of the executive office that the commission would be a part of these discussions because, as Commissioner Powell points out, they also found those discussions very helpful. And if I'm remembering correctly, I think it ended up spending more money because there were in fact applicants who, could have been and should have been funded, and there weren't enough resources. And so, so I apologize for that.
If I could make a suggestion, if you'd be willing to pass this temporarily, we'll work with the staff to draft an amendment that you can consider before the end of the meeting if you take it up
Thank you.
later in the agenda.
Thank you. Commissioner Powell?
Yes, I agree with that, because I'm looking at it and it say to appoint a 5-member grant review committee, but I want to know exactly what the 5 members are. But yeah, I would like that, what you just suggested. Thank you. Yeah, okay.
Any other comments? All right. Oh, I'm sorry, Commissioner Kuhn?
Yeah, thank you, Madam Chair. And because it's not clear on the packet we have, this resolution is now going to the board.
Yes.
Okay, thank you very much.
All right, so on our device, it is time to vote.
Madam Chair, if you would consider just passing this temporarily, then we'll work on an amendment.
Marvelous idea. That's the motion we have, is to pass what we have. I understand you'll work on an amendment regarding the committee membership. Commissioner Hoffman?
Okay, but if we vote and pass this unanimously, it just goes on the consent agenda.
Yeah, I was just suggesting like a parliamentary motion for the moment to pass the item temporarily on your agenda, and then we could take it up later in the agenda while we work with the staff. So you don't need to move it out of committee if you just maybe consider an amendment or a motion to postpone temporarily.
Oh, a motion to postpone this item.
Just temporarily while we work with the staff, and if you would take it up later in the agenda.
Right now, you mean?
Yes.
Right now.
Oh.
We can do the amendment right
To
now.
our September.
I support that.
No,
proposal.
no.
They're gonna bring it right back
Right
at the
back.
end of your meeting today.
We just don't,
Oh,
Yeah, he just want to do a temporary to later in the agenda, today.
right. We didn't want to slow down your meeting, but we're
Yeah.
happy to work
Thank
on
you.
this right now.
thank you. Marvelous idea. Okay.
One a
Do
year.
I have a
I don't
motion
think
to
we
that
have to vote.
effect?
I don't think we have to vote on anything.
We
do
just need to move the item to the
You
end
do
of
have a
the
motion on
agenda.
the floor. I think you need a motion to set it aside temporarily.
Just make it item.
Commissioner Powell made that motion. Who's supporting that? Commissioner Hoffman. So are we voting on the machine or doing a
Yep.
verbal vote?
We'll vote on the machine, and just to clarify, the other motions have been withdrawn. We have the one motion on the table to actually table this item, and then we'll have a motion to take it off the table.
Right.
So I'll go ahead and start the vote.
Yes.
This is tabling it for like 20 minutes later.
Correct. Yep, this table.
Yeah, it's just to the end of the meeting. All right, good to go.
We have 6 yeas, 0 nays to table.
All right, motion carries. We'll see you in
Thank
a
you.
few
See you in a
minutes.
few minutes.
Okay, our next item is the fiscal year 2021 Public Assistance Grant Agreement from FEMA application. And we have Tom Hardesty here to talk to this. Who would like to make a motion? Motion by Commissioner Hoffman, support from Commissioner McGilvery. Welcome.
Good afternoon, Commissioners. Thank you for your time today. You have in your packet, it's a grant application and kind of a grant acceptance. So this is reference the pandemic disaster. The county, with the board's oversight, has expended a significant amount of funds during the pandemic, part of which we believe are eligible from FEMA for reimbursement. So the way these grants operate maybe a little bit differently than normal grants in that it's only reimbursement, it's funds we've expended. They put it under, they consider the pandemic one event, but then they break it up into little projects. So we have one main grant number and multiple little projects within that, which in this case are still ongoing because the pandemic is ongoing. So what we've included in the packet is a grant agreement from the first project that they approved, and this goes all the way back. It was applied for in June of last year, so it gives you an idea for the time frame. And then we continue to work projects through there. It would be the exact same grant agreement, the exact same grant number with a different project. And then, so what we've asked for here, besides approval of this grant, is to allow the chairman to continue to sign these, which will be the same agreement. So we've submitted so far estimates of about $8.3 million that we hope FEMA would reimburse. So the way they do it, FEMA looks at this, kind of goes back and forth. Then once FEMA feels like they have items that they think are appropriate, they send it to the state. The state of Michigan puts it into a grant application packet. At the same time they're sending us the application, they're saying, well, once you sign this application, we'll send you the money. So they, like I said, it operates in a little different format than what we're used to seeing for grants. So we're asking for your approval, and this would help reimburse some of those funds. For example, the $10 million that the board had approved previously and operated under the pandemic committee. This is starting the process for reimbursing the county general fund for those expenses.
Thank you. Commissioner Kuhn?
Thank you, Madam Chair. I don't know, was there a motion on this? Okay. 8.3 million, that's already been expended, correct?
Yes, sir.
It's sort of a slow process, I take it. Do you have any guess as to what percentage you will get back from FEMA?
Well, of the 8.3, that's partially where we're pretty hopeful. We probably were closer to 10 in what we were trying to get out of them originally, and then they kind of kick pieces out or tell us. It's also been a little bit of a moving target. For example, traditionally, for disaster-related expenses, FEMA would reimburse you at 75%, and the locals are responsible for 25%, which can come into different forms, not just cash, but time. Well, they made a change in January to reimburse at 100%. So that's not a normal process. They've also, things that originally they were telling us that they didn't think might be eligible are becoming eligible. So it is a little bit of a moving target. Our goal has been, while we work with finance on this, that we seek all we can from FEMA. And then if there are things that we can't work through that approval process, then we've moved some of those on occasion to CARES Act, or might have to look at ARP funding. But our first choice has been FEMA, and to try to get all we think that is legitimately that they would approve there, and then work down from there.
Okay, and can I ask you this, a crystal ball type of question? What kind of time frame do you expect to get this 8.3 million?
So it's taken us about 14 months from our first submission to get our first approval. Now, here's another change. So, for example, since I put this in the packet, they've actually sent us one more, and that's for a project that was submitted 8th in line. So they've taken certain projects like vaccine and moved that to the front of the line. So again, it's our largest project with them. We have one project for PPE that's over $5 million. That one's been into them for close to a year. I can't get the state to tell me whether they think they'll look at it in a month, this year, or next year.
Okay, thank you
So
very much.
I don't want to give you an estimate that isn't accurate.
Thank you very much, sir.
Thank you. Any other questions? All right, like the game show host says, it is time to vote.
Yes.
Thank you.
This is gotta be kind of nerve-wracking because you don't know what we're thinking. You don't have to.
That's right. Be surprised.
Commissioner Powell?
Oh, sorry.
Thank you.
I also had a question, but never mind.
Okay.
6 yeas, 0 nays.
Thank you,
Motion
Commissioner.
carries. And we have one more comment from Commissioner
I just have
Powell.
one more question for you. Does the county have, like, emergency funds, be it like, for example, we had that power outage? I had constituents who were having issues with food. I called out to the county, and I will be bringing this up with leadership, but I didn't get any response back to even assist me to say, okay, well, Angie, contact these people, or where is that resource at, be it if we have an emergency situation, or if, not to tell me now, we can talk offline, but I also want to put in your ear, where is that information for us to be guided to even go to be able to help our constituents? Because I was out of town and I felt some type of way because I was not productive in assisting them in the way that I thought that we should have probably been. I should have been able to do that. So I was just wondering, do we have anything, emergency food? Because I know we have a lot of nonprofits that take care of this stuff for us, but I think as commissioners, we should be able to pull the trigger too, or get some assistance if something is needed in our communities.
And from our role, it's finding that right resource. So it is finding the right nonprofit. It's finding a group that can help with that. I know on occasion there are staff that have picked up meals and taken them to somebody's home that really needs it. But for the most part, our role as that coordinator is trying to find the right resource for somebody, which in many cases is a nonprofit, which is where you see, for example, earlier when they're talking about helping fund the nonprofits with grants for food or that thing. So you're right. We're not giving them the food directly often, but we're trying to make sure that that's a resource that's available for them.
So is that all put together, or is that something that we need to look at putting together to be more resourceful for us? Because our department heads are not always contactable for us, and that's what I ran into. I didn't get a call back, but I had to go through Tim Grimo to assist me to get some stuff for insulin,
yeah,
right?
and he contacted me.
Right, and then I had Marsha contact you, but I'm just saying, like, I feel like I shouldn't have had to go through all that just to get directly to you to say, and I know some of it's too, I need to learn who is what, but is there somewhere we can just, like, literally go to as commissioners, like, boom, go to your website, go to this, and there's food. Hit them, you know what I mean? Do we have something set up like that? If not, it's okay. It's something we just got to develop, but I just want to know, do we have something like that?
For all of that public, no. And that's why we have a 24/7 number. I have a person on call 24/7. And because there are so many resources for so many different things, that's part of their role is to, somebody calls us, they're in need. How can we help find that right resource? Because our resource, when they were in paper form, were literally this thick.
Okay, so it's just really making a call and just figuring it out. Okay.
Call us at 24/7, 7 days a week.
All right, thank you.
Thank you.
Thank you.
We do got it.
All right, our next item is from Health and Human Services, Health Division, fiscal year 2022 Emerging Threat Local Health Department Agreement Application. Who would like to make a motion? Motion by Commissioner McGilvery, support from Commissioner Hoffman. Then we have Leanne Stafford on our video. Welcome.
Good afternoon, everyone. So yes, this is our application for funding for 2022. Really centralizes around our COVID response for the following year. We're asking just over $9.5 million. The grant does come from MDHHS. The grant period is October 1st of 21 through September 30th of 22. And basically these funds are focused, as I said, around COVID operations. So contact tracing, case investigation, laboratory services, COVID vaccination, immunization clinics. testing coordination if we're in providing it even to our community. And then this also helps for some lab renovations so that we can increase our capacity for that. Again, the majority of the funding here that we're asking for goes towards staffing. A lot of times our contracted services. Last year, all of our regular staff were really focused on COVID response because, most things were shut down. This year, our staff are back to doing their normal jobs and plus working in, that COVID response, in addition to really working with a contracted services agency to bring in additional people to help us with that surplus of, activity, which we did a significant amount last year as well. An agency named Intech has really stepped up and been a great partner in providing us staffing for those times.
Thank you. I don't see anyone with questions. Commissioner Kuhn.
Yeah, I'm sorry. It wasn't, the icon wasn't working here, but that's okay. 9.5 million for COVID response in the next fiscal year. Wow. You were expecting quite a big presence in that area, right?
We still know we have a lot of work to do around contact tracing, case investigation, and even immunizations. Expecting, now that just this week they've come out with the third dose, we're expecting the booster will start in September. And then also, expecting at some point the 12 and under will be approved. And so those efforts, really will have to be sustained throughout the year and even ramp up when maybe those are first announced because we'll see some demand across there. COVID is, as you've heard, is really increasing in the community as the Delta variant becomes the dominant strain. And so contact tracing is very important as we start to see cases spread, and we really want to make sure we can get people isolated when that's identified. So we expect to use the majority of this for those efforts.
Okay, well, thank you. And I see on your breakout that you're expecting to spend $3.5 million on contact tracing. And I know you allocated a lot of staff to that, in the past year or so. What kind of allocation of staff do you expect to do in the next fiscal year for that?
Did you say school year? I'm sorry.
No, the next fiscal year.
Next fiscal year. So again, we have staff that are on mandated programs, and so we're asking them as part of their free time when they have, some downtime there to take on, contact tracing and case investigation. We also utilize an application that helps with the staffing. We still do some follow-up with individuals, but it actually allows people to answer online if they prefer instead of talking to someone every day. Same thing with the case investigation when we are trying to get contact information or close contacts of someone that's tested positive. There's an online form which really helps, collect that information. But again, we have those follow-ups. We expect that we'll increase our contracted services staff just because we know staff are kind of still have to get back to their normal jobs. But we anticipate, especially around those two things and testing and monitoring, that could be a significant increase and using the staff that we're using now and those contracted services.
Okay, and is this a reimbursement grant, or is it something where they're going to give us portions of it initially or on a timely quarterly basis or something like that? How does this grant get sent to us?
You know what? I am going to have to get back to you. I want to say it's a reimbursement grant, but I don't want to say that and tell you incorrectly. So I will have to get that information back to you.
Okay, thank you. And one other question that just struck me in looking through the allowable costs. Do we get 100% reimbursement for indirect costs, or is there some other percentage?
You know what, I'll have to get that answer back to you as well. So my finance person is not on today, was not able to join us, but I will get both of those back to you as soon as possible.
Thank you very much. I appreciate your help.
Any other comments or questions? Commissioner Cavell?
Yeah. Hi, Leanne. Since we're talking about COVID, could you share any information pertinent to like mask mandates in schools and all that?
Yes, so our team is reviewing the data. At this time, we released our guidance actually on Friday of last week. There is a strong recommendation for masks at this point, asking school districts to adopt either a mandate or a requirement in their school districts. I think like somewhere between 5 and 7 at this point have. So we are staying in contact with the superintendents. We will start meeting with them pretty frequently, almost weekly, and we'll continue to watch the data and make decisions based on those trends.
Why not follow Kent, Genesee, and Kalamazoo and all those other counties that are making mask mandates with their health officers?
So I think there's a lot of decisions that have to be looked at. And so I think, it's not just a one size fits all, but just know that we don't take it lightly. We're looking at all the data that is available out there, and that when we make those decisions, it will be based on the data that we're seeing.
Can you clarify? I didn't understand that.
Like I said, we're just watching the data, right? We're watching the data of what it looks like. We're talking with our executive team and administrative team to make the best decision moving forward for Oakland County.
Can you give any indication, and this is my last question, can you give any indication when the data will be compelling enough? Is there some sort of threshold you're looking at or some reason?
No, we're using all data. Look, we're looking at hospital data, right? We receive that data on a daily basis, looking at the number of hospitalizations, the number of cases, basing what each school district is working on and what they're working with. And so, again, it's not a decision that's taken lightly, and we want to make sure when that mandate, or if a mask mandate is issued, it's following the data that we see in Oakland County.
Okay. Thank you, Chair.
Any other questions or comments? We're following Robert's Rules of Procedure, Robert's Rules of Order, and so we had public comment earlier. We don't have public comment now.
So I missed it.
Yes.
Actually, there were 2 sessions of public comment according to your last ruling, so why can't you
Any other
speak
comments or
again?
questions from the commissioners?
This ain't that meeting.
But for full meetings, not.
The Robert rules to regulate this type of a meeting, does it include as well changing the meeting in the last minute like it happened today?
That was a board meeting. This is a committee meeting.
Oh,
So
okay.
we're voting in our committee as commissioners, and
Okay.
it is time to vote. It's on your computer.
Yes.
Thank you.
Six yeas, 0 nays.
All right, motion carries. Thank you. All right, next item is also from Health and Human Services, the 2019 Beach Monitoring Program Grant Amendment 2. Who would like to make a motion? Motion by Commissioner Hoffman, support from Commissioner Cavell. Van Stafford, you're up again.
Thank you. So this is an amendment to our beach monitoring grant. This adds some funding that allows us to continue on through December 31st, 2022. This allows us to pay for staff time. We use our interns to do part of this, so it's a great opportunity for when they come in to be able to see a component of public health. And so they work in this working with beaches and doing testing. And then this also allows for some staffing for our lab and testing equipment so that our lab can do the analysis for our beach monitoring grants. So we're adding about a little over $72,000 to this grant, and it will extend till December 31st, 2022.
Thank you. Comments or questions? All right, time to vote on your computer.
Yes.
I'm a yes too. My thing messing up, so I don't know what's going on. Oh, it just popped up. It just popped up.
Okay, thank you. We have 6 yeas, 0 nays.
Motion carries. Thank you. Our next item is from the Sheriff's Office, fiscal year 2022 Oakland County Narcotics Enforcement Team burn grant application. I have a motion from Commissioner Hoffman, support from Commissioner McGilvery. And who do we have here to speak to this?
Hi, good afternoon, everyone. You have Major Chris Wondrak and Gaya Pierre here to present. Today, we're requesting your approval for a grant application for our narcotics enforcement team. It's a multi-jurisdictional team serving 16 communities in Oakland County. And the grant amount is for $458,812. If approved, this money will be used to fund 1 prosecuting attorney and 2 detective sergeant positions within the unit. And if you have any questions, feel free to answer.
Thank you. This is not the first time we've had this grant either.
Yeah, correct. This is an annual grant.
Okay. All right, seeing no questions, it's time to vote on your computer.
Yes.
We have 6 yeas, 0 nays.
All right, motion carries. Our next item is also from the Sheriff's Department, fiscal year secondary road patrol grant application. I have a motion by Commissioner Powell, support from Commissioner McGilvery. All right, Major.
All right, thank you again. This is another annual grant we're applying for, and we're looking at receiving $406,000 to fund our 416 traffic patrol grant. With this money, it's going to fund 1 sergeant position and 2 deputy 2 positions to enforce traffic laws on secondary roads. As you may not know, we've been receiving this grant for 43 years, and it keeps getting cut every year. We started off with 16 positions, and now we're going to be down to 3 positions. And come September, we're looking at another shortfall of another $250,000, so we're going to lose another position. So we're looking for your approval to submit the application and see what we can get.
Thank you. Did you say initially the grant was for 16 people?
16 positions back in 1979. When the program first started, we had 16 positions funded.
Thank you. Commissioner Kuhn?
Thank you, Madam Chair, appreciate that. Do you have any idea why you're seeing this $84,000 decrease in funding?
Most of the program is generated by traffic citations, and we get a shared formula through the state. And so the state determines how much money we're going to receive. So unfortunately, they keep cutting us.
Okay, and how many positions will you lose as a result of this cut or decrease in funding?
Well, we're going to lose 1 position for sure. And if they happen to resupply the funding, we'll add the position.
Okay, thank you, sir.
You're welcome.
All right, I see no other questions. It's time to vote.
Yes.
6 yeas, 0 nays.
Motion carries. Thank you. Our second to last item, also from the Sheriff's Office, is the contract amendment number 3 for law enforcement services in the Charter Township of Orion for 2019 and 2021. I have a motion by Commissioner Hoffman, support from Commissioner McGilvery. Major?
All right, we're requesting to add one position to the Charter Township of Orion. It will be an afternoon position for Deputy 2, including, their vehicle and all their computers.
Thank you. Any questions? Commissioner Cavell?
Thank you, Chair. Hi, Major and Gaia. First, if I just could give props where they're due, Gaia and Major Wondrak were kind enough to work with us on budget amendments to make a co-responder. They moved some stuff around in their budget, so when we're talking budget amendments, that was nice of you. Thank you. Question about this and also the Pontiac resolution coming up next. Why aren't these included in your budget requests that we were just going through for the budget season?
This is new from the township. The townships actually have enough funding to add another position, so they're requesting to add another position.
Okay, understood.
For example, the city of Pontiac, their budget year started on July 1st. So they just went through their budget process. So now they're adding it. So their fiscal year is different than our fiscal year. So we don't necessarily do contract amendments timely with our budget because it's not our request. It's based on each CBT contract.
Understood. So then, question to that to follow up. These are, though, budget amendments, or these will be amending your budget, correct?
Yeah. So add positions, and then they also add the revenue coming in from the township and city.
Okay. So, and this is more from my understanding of the policing. In Pontiac, there are how many deputies assigned to Pontiac, and like Rochester Hills and Orion Township? What are those three as just examples?
All right, well, Orion Township, when they add another position, they'll be at 37 positions. Referring to Pontiac, when they add 7 positions, we'll be at 107 positions in Pontiac.
And what is it in Rochester Hills?
Hold on. I got it right here. Rochester Hills, we're at 60.
Okay. Thank you.
Yep, you're welcome.
Commissioner Kuhn?
Thank you, Madam Chair. I mean, we've been hearing these reports that the Sheriff's Department is down, 40 deputies or something, and now we're adding these on. How is the hiring going of new deputies to fill all these vacant positions?
As it refers to the road patrol, right now we're pretty stabilized. We have enough applicants to fill these positions. Our big issue right now is with corrections, trying to find enough corrections deputies to fill the shortfall. And they're close to 40 in corrections short.
Okay. Thank you, sir.
You're welcome.
Yeah, that would be, it doesn't have to do with this item, but the 40 shortfall in corrections means mandatory overtime for those deputies who are there now.
Absolutely.
Okay, any other questions? It is time to vote.
You're smiling now.
Yes.
There's 6 yeas, 0 nays.
All right, motion carries. Thank you. Last item from the Sheriff's Office is the contract amendment number 2 for law enforcement services in the city of Pontiac, 2019 to 2021. I have a motion by Commissioner Hoffman, support from Commissioner Powell.
No, she should move it.
I have a motion by Commissioner Powell, support from Commissioner Hoffman. Next time I'll look from left to right.
Yes.
Okay, the city of Pontiac has requested 7 new positions within the city. 3 of them will be traffic spots. and 4 will serve as community policing officers. So we're requesting to add these positions to the budget.
Thank you. Commissioner Powell?
I just want to tell my colleagues that I'm so ecstatic that my city has decided to do this. We needed that more presence. We needed more presence, especially on the community front with the community liaisons officers. The unique number of 7 is basically, like he said, it is a unique split. However, they came up to that to kind of also have a representative office per district because we have 7 council districts. But overall, the sheriff department has been doing a phenomenal job in our city. I'm proud of our council and our mayor for coming with this proposal or resolution. And I think it's going to be great in reducing our crime and moving our city even forward with our crime stats and improving. So thank you very much.
Thank you. Commissioner Cavell?
Yeah, thank you, Chair. I like the idea that there are 4 community officers. That sounds great. Hats off to Pontiac. I think, though, the 3 others and also the fact that Major Wondrek, I was looking for it earlier, and thank you for sharing that. Just to give context, Rochester Hills, city of 75,000 people, has 60 deputies there. Pontiac, city of 58,000 and declining, has a officer population of 100, soon to be 107. That's textbook over-policing in majority minority communities that are poverty-stricken. So I just want to say, I'll vote yes on this because there's community officers, but this is a good example of that.
Anything else? All right, Commissioner Powell.
I just want to say to my commissioner, the numbers is different for a reason. Our city has a lot of issues and things going on. I'm totally in agreement with you with the over-policing. I get that. But as of right now, coming from when we were underserved and now we're trying to catch up, it's been a very safer experience. Just from me living there, born there, seeing the transition from Pontiac Police to Sheriff Department. So as of right now, until the crime reduces or get to some type of control there, I am in support of the 107 that we do have there. Thank you.
Thank you. Commissioner Hoffman?
I'd just like to add to that. I do a lot of work in the city of Pontiac, and I talk to some of the citizens, and they don't know I'm a county commissioner. And I specifically ask them about the sheriff department, and they love them. They think they're doing a great job, and they're well served. And I've had to use that before on some of the jobs I do in Pontiac. I mean, they are right there. They do a great job.
All right, anything else?
I do.
Commissioner Cavell for the second time?
Just a quick thing, I heard apparently Warren Buff said it, so you'll like this, Bob, that if you tail anyone for long enough, you'll find a reason to pull them over. So you talk about the over-policing and that, you're going to find crime if you're looking for it. The more people you have looking for it, the more crime you're going to find. Just that.
Anything else?
No
Time
comment.
to vote.
Can we move forward, please?
Yes.
Six yeas, 0 nays.
All right, motion carries.
Thank you all for your support.
Thank you. Nice to see you, Gaia. Bye, Major.
Yep, bye.
All right, we are returning back to item 8A, our Oakland Together Mental Health and Wellbeing Nonprofit Grant Program Policies and Procedures. Do I have a motion to return to this item? Motion by Commissioner Powell, support from Commissioner Hoffman. Welcome back, Mr. Ward.
Thank you, Madam Chair. Thanks, committee members, for your patience. We've worked with Michael and the staff to draft an amendment to address the concerns that were raised, and I hope that is before you, or it's being passed out right now, but utilizing the language from one of the CARES Act resolutions. This is the model that was utilized before, and hopefully this addresses your concerns.
All right, are there any comments on the amendment before us regarding this item? Commissioner All right, then we'll vote.
I think you need a motion on the amendment, Madam Chair.
All right, we did have a motion on that.
I thought I did. I thought I did the motion.
I think you had a motion to take it back up again.
Oh,
Yeah, we
I'm
motion to take
sorry.
it off the table.
Okay,
Okay.
So now you make a motion with the amendment.
Commissioner Powell makes the motion, supported by Commissioner McGilvery. All right, time to vote. You did your job so well. There's no further discussion. We can vote.
One other thing, Madam Chair, if we could, I don't know if it's a technical issue or if you needed an amendment for it, but the attachment A, as Commissioner Kuhn pointed out, if we could move that to the memo cover page so that it covers both the content of the memo and the procedures that it
So you're talking
preceded.
about the last line of the amendment?
Well,
Procedures
this
as
is
outlined in
kind of
the
a technical issue that, the document, the backup documents that were presented, the attachment A title was only on 2 of the pages. It wasn't on the memo that preceded it, and the content that's in the memo was meant to be part of what you're considering as the total grant policies and procedures.
Does that make sense to everybody? Perfect. Time to vote.
Yes.
6 yeas, 0 nays.
All right, that motion carries. Thank you for the time spent to bring that back to us.
I think you need to vote on the final passage now.
motion as amended.
All right, time to vote. Oh,
Yes.
we need another motion? Commissioner Powell
As amended.
moves, supported by Commissioner Hoffman.
So I moved it,
Thank you.
and Hoffman support,
Thank you.
and we vote again.
Yes.
You have 5 yeas, 1 nay.
Motion carries. Thank you. There's no further business to come before this committee, so at 12:40, this committee is adjourned. Thank you, everybody.
If you could all just log out